Welcome to another video of Acharya Nidhan Academy. In this particular video, we are going to discuss about meaning of slokas, or what we can say that is the channels. Before going into the description, we are going to learn some of the concepts that we need to concretize. First, if you know about the physics, chemistry, and biology and Ayurveda fundamentals, then any of the information that is explained in Ayurveda can be learned with deep dive understanding. For this, we have to practice the concept of a minimalism. So, what do you mean by minimalism? We have to take one particular small topic and we have to learn from multiple angles. For example, we are going to learn the concept of dosha from the point of Rachana Sharira, from the point of Kriya Sharira, from the point of Yoganidhana, from the point of the Shastra Vaishishta Kalpana Vijnana, from the point of Dravyaguna Vijnana, from the point of the Swasthavrata, from the point of the Kaya Chikitsa, Shalya Tantra. We are going to learn the simple concept of dosha. Then we can have a deep dive understanding as such. Why we need to know about this particular concept of minimalism? Why we need to know about the concept of dosha? If we are trying to apply them, then we can have a deep dive understanding of any of the concepts explained in Ayurveda. That is, whenever if you want to have the best learning, so you have to start from the basics. So when you are entering into the field of health, which is having multiple disciplines, the Western medicine or the homeopathy medicine or the naturopathy medicine or Ayurveda medicine, so that the multiple specialities are there. So we have to start from the scratch. Whenever if you want to learn from the scratch in terms of Ayurveda, we have to have the deep learning of Kriya Sharira. Then we have to learn from each and every corner. We have to have the learning. If you know about it, then the learning Roganidhana will be very easy. If you know about the concepts mentioned in Roganidhana from each and every corner, then learning Kaya Chikitsa will be easy. So in other words to say, we have to be thorough with physiology, which will help us in learning altered physiology, which makes us to have an easy understanding of restoring the altered physiology. So whenever we are going into learn any of the concepts, try to know about the pattern identification. What actually pattern refers to? Pattern means that is repeatedly occurring observations. So that means, suppose, let me give you one example. If you are consuming sour buttermilk, that means you are taking that particular buttermilk. The first step, you are going to add little bit amount of the salt, pepper, etc. Second step, you are going to mix it. Third step, fourth, then you are going to consume it. So that means, so whatever may be the etiological factor that you are going to identify, try to identify the patterns. So suppose if a person is taking the curds which is having sour taste at about, say for example 10 p.m., that is likely to increase pitta dosha in the body. Suppose if that particular sour buttermilk is added with the salt, again that will be responsible for even much vitiation of pitta dosha. Suppose along with the salt, if pepper is being added, it is leading to still further vitiation of pitta dosha. So like this, so try to identify the patterns, so that which will be helpful in modification, we are modifying the patterns. That means if you are observing curd intake, stop it. Sour buttermilk, stop it. Or pickles, stop it. So like that, so which will be responsible for the pacification of pitta dosha. In turns, you have to create a new pattern. For example, simple warm water drinking, or simple warm milk drinking, or thin milk is drinking. That means which is not having the layer which is present after the boiling the milk, that should not be there. So that means, so we have to create a new pattern so that we can have the better understanding of the subject. So when you think about this is a new concept that we are going to learn. when you are learning Ayurveda, we have to learn the environment properly. If you are learning environment properly, that means we have to be very thorough with application of physics. When you are able to apply the physics in terms of the Ayurveda, then we can have a deep dive understanding of any of the concept mentioned in Ayurveda. Follow one particular mentor while learning any of the Ayurveda fundamentals. So why? Because nowadays millions of informations are available in the social media. So that means millions of Ayurveda practitioners are giving you multiple informations. So that means if you are following all those informations, you are moving in the multiple directions. So that means their viewpoints will be different. And it is very difficult for you to connect all those informations. For you have to have your own creative learning. Hence, follow one particular mentor. When you are following one particular mentor, you can able to visualize his past thought processes, present thought processes, and future thought processes. That is the benefit of following one particular mentor. So you have to continuously follow. Specifically, if you are following at least for 1 month, you can able to note about his thought processes. Then you can have your own thinking process in that particular regard. So whenever you are going to practice the learning, so that means you have to learn Ayurveda information from the Ayurveda angle, Western information from the Western angle. Then try to link the informations at multiple levels. If you are able to link at multiple levels, then it may indicate you are moving in the right direction. If you are not in a position to interlink the informations, then you are not moving in the right direction. There may be a possibility of flaw in your learning or in our learning. Hence, we have to try to bridge the information to multiple levels. If you are able to bridge it, then that is the right way of learning as such. And whenever if you are learning Ayurveda, it should be learned like learning a new language. Whenever if you are learning a new language, most frequently used words, its meaning that will be learned first, then less frequently used words, then less frequently used words. Whereas, for example, when you say, when learning Roga Nidana, the most importantly used word is Nidana. Then comes the that is the Samprapti. Then comes Srotas, Agni, Ama. So like that, these are the different concepts that are being considered to be. You have to learn these informations step by step, one by one. Then you can have a better understanding. So with this small introduction, so let us discuss something about the meaning of Srotas as such. When you think about Srotas, it is nothing but it is the as per the current understanding, it could be the tubular structure or a channel wherein any of the movement substance that will be moving along with that particular channel. So as far as the derivation of Srotas is concerned, it will be derived from Sravane, which is having 4 different meanings. That is ooze, or permeate, or filter, or exude. So these are the 4 different meanings. So when you think about the over collective meaning in this particular angle, that is we need to know about the structure of Srotas. So Charaka Samhita says in Vimanasthana, so that is being said to be Swadhatu Samavarnani Prattasthulani Anunicha Srotamsi Dirghani Akritya Pratana Sadrishanicha. So that means as far as structure is concerned, it will be having a similar color of the substance which is the particular substance is carrying. As far as its further the physical shapes are concerned, some of these structures are considered to be elongated. For example, alimentary canal or otherwise the respiratory tract, etc. They are elongated ones. And some of the things they are usually rounded. that is the cell or the multiple shapes, whereas the third one, that is a tubular structure, as it is just like the, what do you say, that the alimentary canal inside it. So any of the capillaries, we can say there may be a possibility of thin structure which is having a hollow in between, or otherwise you can say that is about the meshwork, that is like reticular system, like that. So this maybe, these are the different four different ways of structures of a Srotas. And when you think about it, functions of the Srotas as such, you need to know about the concept of Stirling forces, concept of sludged blood, concept of macromolecules and micromolecules, concept of digestion happening in the alimentary canal, concept of armor formation, and concept of Kriya Kala. When you know about these different informations, we can have the functioning of this process can be learned in a better way. So in a brief introduction, so you are learning about the Stirling forces as such. What actually Stirling forces refers to? It is nothing but the variety of Srotas, variety of the forces that is acting across the capillary membrane, wherein the transport of nutrients and metabolites that will be happening across the capillary membrane. So that means what actually Stirling forces refers to, they are nothing but the pressure gradients which are being exerted by water, proteins and electrolytes. So when you think about the functions of the water present in the alimentary canal, that is actually responsible for the push effect, wherein the that is the proteins and electrolyte, they are responsible for the pulling effect. The pushing effect, that will be done by hydrostatic pressure, whereas pulling effect, that will be done by oncotic pressure, wherein the interstitial spaces, the hydrostatic pressure is termed as tissue tension, that is responsible for the pushing effect, whereas oncotic pressure of the interstitial space, that is termed as oncotic pressure itself, that is responsible for the pull effect. So when you think about the capillary, so these four different forces are acting simultaneously. Doesn't mean that initially hydrostatic pressure will be occurring, then oncotic pressure, then tissue tension, then oncotic pressure, interstitial spaces. Not like that. All these are functioning simultaneously. Suppose if the blood pressure of the heart is considered, and that is the blood pressure of the human body is considered to be 120 by 80 millimeter of mercury. It is nothing but the that is what we can say, that is the pressure that is exerted at the heart, that is left ventricle. At that particular time period, the hydrostatic pressure at the capillary will be around 32 millimeter of mercury, wherein hydrostatic pressure at the venous end, it will be around 25 millimeter of mercury, whereas the oncotic pressure at the capillary end will be throughout, it is constant, that is 25 millimeter of mercury, whereas tissue tension will be of 4 millimeter of mercury, whereas oncotic pressure is considered to be at 8 millimeter of mercury. So with this particular intention, so the pressure gradient, the amount of this particular pressure altogether at the arterial end, that will be responsible for the movement of the nutrients that is moving from capillary to interstitial space. So when that particular thing is happening, so when it is coming towards the venous end, the amount of water entering towards the venous end, that will be less. Hence the viscosity of the fluid at the arterial and venous end is considered to be, at the arterial end it is thinner, whereas at the venous end it will be thicker. Hence the slower movement of the blood is happening at the venous end, whereas at the venous end, this particular hydrostatic pressure, oncotic pressure, tissue tension and oncotic pressure of the interstitial space that will be responsible for the movement of the metabolites etc. that is moving from interstitial space to the capillary. So this is what actually responsible for the this change in the consistency of the blood. For example, if this is considered to be the milk, if you consider milk as the consistency at the arterial end of the blood, whereas this one, that is honey, you can see the consistency of the blood is thicker at the venous end. This will be the consistency of the blood at the venous end. Hence, whenever there is any kind of the inflammation is happening at the capillary level, so the arterial end, it will be the consistency will be thinner, whereas in case of the venous end of the capillary, it will become even much thicker. So when you think about the pathogen entry that's happening at the alimentary canal, the most commonly what we are going to do is adhyasana. The term adhyasana refers to when a person is consuming the food substances before the digestion of previously ingested meal. So when a person is consuming the food at the stomach, it may remain for a period of almost 2 hours. Within that particular time period, if a person is consuming the food again, that is being termed as adhyasana. And most of the people are consuming carbohydrate rich diet. When that is happening, that will be responsible for the inflammation to happen at the the stomach end. When there is inflammation is happening, that will be responsible for the proliferation of infection to happen in the stomach. So when there is entry of the food substances adhyasana, that will be leading to the stasis of the food, carbohydrate rich food in the stomach for even much longer time than 2 hours. That will be leading to the proliferation of infection. From there, infection leading to the inflammation of the the stomach, that may happen, wherein this actually responsible for the movement of the substances, that fluid that will be happening from the stomach into the lumen of the stomach. What we can say, this could be the stage of prakopa, wherein if the digestion is not happening in the stomach, after a matter of 2 hours later, the food may enter into small intestine as macromolecules or intermediate molecules. In the same, when this is happening, so the macromolecules will be moving towards the the wall of the small intestine. Thereby, it is again responsible for the reduced secretion to happen in the small intestine also. When that is happening, naturally the phenomena will be the same, that is inflammation of the small intestine. Thereby inflammatory markers are generated. Thereby the fluid etc. that is going to get into the small intestine. Thereby the prakopa may happen in the small intestine. The same way, the macromolecules, after a matter of 6 hours later, it may enter into large intestine. Therein macromolecules will be moving towards the wall of the large intestine, where that is again leading to proliferation of that is the microorganisms. Thereby inflammation will be happening. Inflammatory markers are being produced. Inflammatory markers are responsible for the more and more secretions to enter into the large intestine. Now the question arises, stomach is considered to be the organ wherein the macromolecules will be converted into intermediate molecules. So the same amount of macromolecules with the same molecular size will be entered into small intestine or large intestine? Yes, there may be a possibility. Why? Because when a person is doing adhyasana, that will be leading to the dilution of hydrochloric acid. When do you say hydrochloric acid is being diluted? When the pH of the gastric juice is between 1.8 to 3.5, that is normal optimal pH for the proper digestion. When the person is doing adhyasana, the pH of the gastric juice will be moving towards the alkalinity. That means more than 3.5 or 4 that may happen. When that is happening, then the proper that conversion of macromolecules into micromolecules that will be hampered because of inactivation of pepsinogen into pepsin. Because of a reduced pepsin formation out of inactive pepsinogen, this will be happening. That is the reason these macromolecules are not in a position to get digested in the small intestine. The same will be entering into stomach, the same will be entering into small intestine, and the same will be entering into large intestine. In other words, whatever the features are observed in the stomach due to the particular infection, inflammation, etc., that can be considered as the Sama-Kapha condition. And the pathological events are happening in the small intestine because of the entry of macromolecules. What we can say, it could be Sama-Pitta condition. Whereas the pathological events of Ama is happening in the large intestine, then we can say it could be Sama-Vata condition. So when this is happening, pathological events are happening in the small intestine or the alimentary canal, depending upon the nidana sevana by the individual, the possibility of entry of these macromolecules may happen towards those regions. Suppose if the person is doing more amount of vegetable cutting or cooking in the hands, specifically if a person is a cook by profession, then whatever these pathogens are being present from the or absorbed from small intestine, stomach, small intestine, large intestine will be entering into upper limb. Whereas if the person is doing the more amount of walking or running like marathon, in that particular situation the pathogens which are absorbed from stomach, small intestine, large intestine will be moving into lower limb. If the person is doing any of the exercises related to abdomen, then pathogens are being present from the stomach, small intestine, large will be moving into this trunk. From there it will be moving into interstitial compartment. From there it will be moving into the intracellular compartment of the trunk. Suppose if the person is doing more amount of thinking activity, then pathogens will be moving from stomach, small intestine, large intestine into the intravascular compartment of the head. From there it will be moving into interstitial compartment. From there it will be moving into intracellular compartment. This is how the pathogens etc. that will be moving from the alimentary canal into the the Bahya Roga Marga or Madhyama Roga Marga. So the take home messages from today's discussion will be whenever if you want to learn any of the learnings with deep dive understanding, we need to know some of the fundamentals as such. Here some of the examples are being given. Need to know about the concept of Rogamarga, Srotas, Agni, Ama and Kriyakala. Whereas you need to know about the art of interlink or linking between the concepts of Roganidana. And depending upon the Nidana, the person may have manifestation of symptoms. That's all for today. Dear ANA friends, if you are liking this particular video, then mention below what are the 3 major learnings from today's discussion. And mention below what would be the next topic you like to have discussion in the Acharya Nidana Academy. And if you are really liking this particular video, then spread this video to the maximum true Ayurveda learners, so that we can make a huge movement out of this particular small message. Thank you. We will see in the next time with new information. Thank you once again.